Well, every day, babies, of course, are born throughout Indiana, and some of those babies are born drug dependent.
Nicole Christine, she spent weeks looking into this issue of neonatal abstinence syndrome. She has a special report on a statewide effort to combat drug dependency in those little babies.
Mike and Dana, this effort extends from the State House into individual hospital rooms where innocent babies are born already tied to a statewide drug crisis.
They don't get the prenatal care that they should, and I think that's because of the stigma.
Every 15 minutes, a baby is born in the United States suffering from drug withdrawal, a condition called neonatal abstinence syndrome. The symptoms of NAS range from immediate to long-term.
The normal mom would rock a baby to sleep. They prefer to be swayed. They don't do well in crowds. They don't do well in bright lights or like lots of music, TVs, variety of things.
Typically what we see is some irritability, crying at first. If it's more severe, then we see some other more severe symptoms like seizures and things like that. Down the road, as they get older, school age, typically what we see is some developmental delays, some learning disabilities.
Studies from the National Institute on Drug Abuse show that NAS also extends a baby's hospital stay, with the average NAS baby staying in the hospital for over 16 days, and greatly increases medical costs to over $66,000 on average. In Indiana, NAS can be traced to high numbers of drug abuse and opioid prescriptions. According to the CDC, Indiana providers prescribed nearly 20 more opioid prescriptions per 100 persons in 2017. And in the more rural Wabash Valley, there are several socioeconomic factors leading to babies being born drug dependent.
We have a high Medicaid population. We have women who choose not to breastfeed.
Public transportation is a big piece of that. I also think that behaviorally, there's a different culture when it comes to rural mental health. I don't think there's a mother or father out there that don't truly care about the baby. But because of the addiction issues and some of the needs in the county, there's barriers to getting to where they want to go with their family.
Healthcare professionals in Indiana say some mothers using drugs are hesitant to get help.
Because of the pregnancy, the addiction is uncovered. There's a lot of shame for people in that area.
Women were very, very concerned that automatically, if we identified that they had a substance use disorder in pregnancy, that their child would be removed from their home when the baby was born.
But with recent data showing nearly twice as many babies born with NAS in Indiana versus the U.S. average, a response was needed. That's when a statewide task force with positions like perinatal nurse navigators was created to help reach moms where they're at.
I would meet with the family, work with them during pregnancy, and even until the baby is born, until the baby is 18 months old. And then from then, I can still be a bridge to help them with other resources.
Additionally, a new Indiana law requires verbal screenings for drug use in expecting moms to get them connected with resources sooner.
This is not so that we can report this level to DCF. That's private health care information that is between that woman and her provider.
Rather, the mandatory screening allows the mother to get help early on and combines with other statewide initiatives to lower the number of babies with a drug dependency.
We are very proactive. We're all getting better, but there's still a lot of work to do.
55 hospitals are actively engaged in the Perinatal Substance Use Disorder Task Force, and Dr. Box says the presence of this programming has already showed results, including a decrease in the cost of NAS babies by lowering hospital stay time.
All right, and during that story, you may have seen, if you have the WTWO app, a notification on your phone about this story.
Yeah, check that out. It'll send you to our website, mywabashvalley.com. Once there, you will find plenty of web extras for this special report.